Welcome back to Nurse Dante. Today we're diving into a critical class of medications in cardiac care, cardiac glycosides. When a patient's heart is failing, it struggles to pump blood effectively, leading to systemic congestion and decreased output. Cardiac glycosides are positive inotropes. This means they increase the force of myocardial contraction, helping the heart pump more efficiently. The most common example you'll encounter in clinical practice is Digoxin, often referred by its brand name, Lanoxin. It works by inhibiting the sodium-potassium ATPase pump, which ultimately leads to an increase in intracellular calcium. It's primarily used for heart failure and to control the ventricular rate in patients with atrial fibrillation. Now, while effective, these medications have a narrow therapeutic index. Common side effects include fatigue, bradycardia, and headache. Watch closely for gastrointestinal distress, anorexia, nausea, and vomiting are often early signs of toxicity. A classic and specific sign of digoxin toxicity is visual disturbance, like seeing yellow-green halos or blurred vision. The most serious adverse effects are cardiac arrhythmias, ranging from PVCs to dangerous heart blocks. Before every dose, you must assess the apical pulse for 1 full minute. If it's less than 60 beats per minute, hold the dose. Monitor serum digoxin levels frequently. The therapeutic range is narrow, typically between 0.5 and 2.0 nanograms per milliliter. Here is a critical clinical pearl. Hypokalemia, or low potassium, significantly increases the risk of digoxin toxicity. There are several contraindications we need to be aware of to ensure patient safety. Avoid these in patients with ventricular tachycardia or advanced heart blocks unless a pacemaker is in place. Use extreme caution in patients with renal impairment, as digoxin is excreted by the kidneys and can easily accumulate. Be wary of drug interactions. Loop diuretics can deplete potassium, further predisposing the patient to toxicity. Patient education is key. Teach them to monitor their own pulse and report any new visual changes or loss of appetite immediately. Advise patients to take the medication at the same time every day and never skip a dose or double up if one is missed. Patients should also monitor their daily weight. A gain of more than 2 pounds in a day could indicate worsening heart failure. In cases of severe toxicity, the antidote is digoxin immune fab, commonly known as Digibind. Remember that geriatric patients are at a much higher risk for toxicity due to decreased renal function and polypharmacy. When administering IV, give it slowly over at least 5 minutes to prevent vasoconstriction. Continuously monitor potassium, magnesium, and calcium levels, as imbalances in any of these can affect digoxin's action. To summarize, cardiac glycosides increase the force of contraction but decrease the heart rate. They are a double-edged sword. Your nursing assessment and vigilant monitoring are the patient's best defense against the risks of this potent medication. Always check the pulse, monitor those labs, and be on high alert for those early gastrointestinal and visual signs of toxicity. Thanks for joining me on Nurse Dante Podcast. Keep studying hard, and I'll see you in the next episode.